Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So yesterday we got to discuss very important coding guidelines. So I think I have discussed around 11 to 12 questions. Remaining some 3 to 4 questions I missed to discuss. So today I will cover those. And after that we will move to surgery portion. Today I am taking integumentary section and we will see what are the important prophy procedures that you can expect in integumentary section, and also like whatever the keywords that students have gave, those questions I have collected. So I will discuss the question and answer as well. Okay, so please do watch video till end, and if you find it informative or useful, do subscribe to my channel, and please do share with your medical coding friends who are appearing for CPC exam in this year. Okay, so yeah, I think up to here I have discussed in the previous video. So today, 12th question is, what statement is false in reporting a personal history of ICD-10 CM code? So the guideline here, you can see other options you can just go through. I'll just highlight the answer. So here option A says a personal history code can be reported as first listed code when the reason for encounter is for screening. Okay, screening codes we can use as first listed ICDs, first listed, that is primary diagnosis, but personal history code we generally don't keep it as a primary diagnosis. Okay, so this is a false statement. So for 12th question, your answer is option A. And which statement is true regarding? Actually, it is true. Which statement is true regarding lesion excision? Okay. Lesion excision codes are selected. This is wrong. And this one also wrong. Last option D is correct. Option D says lesion excision codes include removal of lesion with margin and simple layer closure when performed. So whenever you are dealing with the excision procedure, excision plus simple repair. That means provider did excision first, and to close that excision site, if provider utilizes simple repair, then that simple repair is included in excision procedure. Okay, so you don't have to code simple repair separately. So for 13th question, answer is D. So next, according to repair, that is closure procedure, which type of repair is reported when repair involves layered closure of one or more of the deeper layer of subcutaneous tissue and debridement of wound edges? So only layered closure is documented. You will code it as an intermediate repair. Okay. But in this question, they also said there is a debridement of wound edges. Okay. So when we have this debridement, in our complex repair coding guideline, they clearly says when the documentation says exposure of bone, exposure of cartilage, okay, and debridement of wound edges, all of this will contribute towards complex repair. So 14th question, answer is B. Next, they asked the full description of the CPT code 44361. So 44360 is small intestinal endoscopy or enteroscopy beyond second portion of duodenum, not including ileum. And here the procedure is collection of specimen by brushing or washing method. Next, 44361 is biopsy procedure. So you have to give the full description: small intestinal endoscopy or enteroscopy beyond second portion of duodenum, not including ileum. So there is a semicolon here. Okay, so after semicolon, you need to add this: biopsy of single or multiple. 44361 code description. Next, last coding guideline: what is the correct way to code a condition when both abuse and dependence are documented? So when both abuse and dependence are documented for the same substance, you have to code only dependence. Okay, assign only code for dependence. Same way, if they give use, abuse, and dependence, still you code only dependence. Okay, so please go back and refer the ICD coding guidelines for use, abuse, and dependence. Okay, so these are the important coding guidelines. So if you are newly watching this video, I have covered all of these coding guideline explanation in the previous video. Please go back and check the playlist. Okay, I have added the playlist of 2025 CPC exam preparation. In that, whatever I have made, in all the important videos I have added there. Please go back and once check there. So these are the important guidelines. And now we will move to our surgery chapter 1, integumentary section. Okay, so first what I will do is I will let you all know what are the important prophy or outpatient services we have under integumentary section. Okay, why? Because this CPC certification, certified professional coder, is all about professional services. Okay, professional service means either we will be able to get a procedure from the prophy coding or outpatient coding. Okay, so it's like not too much complicated procedures are done in OP or prophy coding. Okay, professional services. So by taking all those insights, what are the topics that you must and should? Okay, book is too big. Okay, there are so many concepts to learn, but in that you need to focus on certain concepts which are very important for your exam and also for your career. Okay, so here from the integumentary section, first we have the important concept called fine needle aspiration. See here, after this we will discuss real-time questions from the exam also. So I've added questions here. Okay, some 10 to 15 question I think I've added. If you join the classes, everything you will be able to get to learn. But here I have added some 10 to 15 I think. We'll discuss this question later. Before that, we'll understand a few, what are the concept you should go through. Like, so for example, if you are a beginner, then you just have to start. Like, it's a roadmap for you. What are the concept you should sit and study from the integumentary section. Okay, so integumentary section will give you 6 marks for your CPC exam. So first concept, you should start with FNA. Okay, fine needle aspiration. Fine needle aspiration, what are the coding points? Here there are 5 sets of code. First set of code is like without using any guidance. And remaining 4 set of guidance are what kind of guidance they are using to perform FNA. Ultrasound guidance, fluoroscopy or CT, MR. Likewise, codes will vary. Okay, so that concept I have to teach, so it will take more time. So I'm just giving you the insight here. Next, incision and drainage. So here also IND procedures, incision and drainage of abscess, okay, and pilonidal cyst. Okay, both are very important. So you should be aware like how to differentiate between simple incision and drainage and complex incision and drainage. Next, debridement. In this debridement, there will be 4 set of codes. Okay, first set of code is like infected skin. Next set of code is necrotizing soft tissue infection, and next set of code is for open fracture or open dislocation, and lastly we have wound debridement. Okay, so the coding guidelines, everything we'll able to discuss with a practice question. And burn treatment. Okay, for burn treatment, here in this code section you will be able to see only for the local treatment. Okay, so what you have to check, you have to check the percentage, how much patient got burnt. Based on that we are going to assign the code. Also here one more procedure, hysterotomy procedure is there. For hysterotomy you have to check how many incisions that provider has did. Based on incision you can utilize add-on code. Okay, these are the coding points for burn. Next, biopsy. Here biopsy, we have 3 types of biopsy. One is tangential biopsy and punch biopsy, and lastly incision biopsy. Okay, so incision biopsy is the severe one, punch biopsy is the second severe one, and tangential biopsy is the third one. Okay, so the coding guideline we have here is you are only supposed to use only one primary code, and like whenever provider performs 2 to 3 lesion on a same day and utilizing 2 different techniques. Okay, so at that time we have to go and check the particular codes for which biopsy they did. Say for example, incisional biopsy and punch biopsy, both technique they have utilized, and they've performed on a same session on 2 different lesion. So in this case, you will code for first lesion incisional biopsy primary code, and to report punch biopsy, you will take the add-on code from punch biopsy. Okay, we cannot code 2 primary codes together in the biopsy concept. Next, skin tag removal. Here also, we just have to check how many skin tags being removed. Accordingly, we need to code. Okay, up to 15 skin tags and more than 15 skin tag means we will have the additional code to utilize. So we will use that. Then excision procedures. Here in excision of benign lesion, excision of malignant lesions, both concepts are important. Here you should be aware how to measure the lesion diameter plus margin diameter if provider did not give margin, like it is included in margin. So then you need to measure and you have to take the code. Next, ATT procedure. In ATT also, we will check the square centimeter, how much adjacent tissue transfer they did or what type of plastic they have utilized. Based on that, we will code. Next, flaps. Flaps, like we have a different graft. Okay, we have to check what exact graft they have taken or they did. Based on that, we will be able to code flap procedure. Next, destruction procedure. In this destruction, we have pre-malignant lesion destruction, benign lesion, and malignant lesion. So you have to check what lesion they have destructed, and accordingly, you need to assign the code. Next, Mohs micrographic surgery. Here it is the surgery for skin cancer. Here anatomical site you have to check and how many stages that provider did, and from each stage how many blocks they have removed you need to check. Okay, for stage coding we will utilize 17 series, like the primary stage code and additional stage code. And if you get any extra block which is more than 5, okay, then you are going to utilize the universal code 17315 additionally. Okay, so I'll explain with the question. Next, repair and reconstruction. So in the repair, we have 3 types: simple repair, intermediate repair, and complex repair. All 3 repair have their own coding guideline and different anatomical grouping. So the coding points are, we need to check those, the anatomical grouping, and also what is the laceration centimeter. Okay, and additional coding guideline we have is, whenever patient comes with a multiple laceration, that multiple laceration falling in same anatomical grouping or not, you need to check. If they fall in same anatomical grouping, you can add the square centimeter or the centimeter of the laceration, and you can just code only one code. Okay, so that is just orally if I tell only this much information, I hope you may not understand. But I, at least go and refer this concept. Okay, in detail if I want to explain, it takes 2 days. So in my regular classes, 2 to 3 days it will go in just integumentary procedures. So next, nail procedure. So in nail procedure, you have to check what exactly they are doing, avulsion or ectomy procedure. Okay, and also here modifiers are important. And breast procedure, mastectomy procedure, and breast reconstruction procedure, both are very important. So like only biopsy they are performing, or biopsy plus localization device using image guidance, and only localization device placement and image guidance. So there are different scenarios under breast procedure, and we have to check. Okay, and accordingly we will code. Coming to mastectomy, in mastectomy we have various types. Okay, radical mastectomy and partial mastectomy, modified. There are so many types. Okay, so according to the particular type what they have did, we will take the code from this series. So these are the 14 important concepts. So do not ignore these concepts. Just go back and open your CPT book and refer these topic coding guidelines and understand how to lead the code, and what are the particular coding points we have for each of these topics. Okay, so all of these will be discussed in my classes. So if you are interested, please do join the classes. Okay, and next, now I am going to discuss the current year questions. Like the students got these questions, taking those keywords, I have added the questions here. So we'll discuss, and I'll, like whatever the coding guidelines needs to be discussed here, I'll explain. So first question, debridement of pressure ulcer. So the question is about debridement of pressure ulcer here. So a patient present with pressure ulcer on both lower extremities, and physician debrids 25 square centimeter of ulcer to the bone, 10 square centimeter ulcer subcutaneously, which is on right heel, 15 square centimeter of ulcer subcutaneously, which is left heel. So 25 square centimeter on bone level, remaining 2 location for subcutaneous level. Okay, so first there are options also here. So first I'll make you understand the coding guideline we have for debridement. Okay, so this is the coding guideline you can see here. When performing the debridement of single wound, report the depth using deepest level of tissue removed. And in multiple wounds, sum the surface area of those wounds that are at the same depth, but do not combine the sum from the different depth. Okay, this is the coding guideline we have for wound debridement. Okay, so in our question, we have multiple sites. Okay, we have multiple wounds. One wound is on right calf, and remaining right heel and left heel. So what you have to check? So you have to check the depth now. In the first here right calf, there is a bone level. Okay, bone level debridement is there, and remaining right heel and left heel, the depth is same, subcutaneous level. Okay, so subcutaneous and subcutaneous, these two, you can add the square centimeter, and you can give only one code, one set of code you can give. But when it comes to here bone is a one more, like it's a deepest level, you cannot combine with subcutaneous level codes, so you have to code the bone separately. So bone separate code, remaining these two locations as depth is similar, we can add the square centimeter. 10 plus 15, you will get 25 square centimeter. So for 25 square centimeter of subcutaneous level, you can report the code. Okay, so options, there are options here, you can take time, and you can just go through. So the answer here, the correct answer is option A. Okay, option A. Let's check the code description. 11044. 11044 is the wound debridement of bone level. Okay, 11044 debridement of bone. Okay, it includes subcutaneous tissue, muscle, and fascia if performed first 20 square centimeter or less. Okay, so the primary code covers first 20 square centimeter. In our question, we have 25 square centimeter. Okay, so that's why we need to utilize add-on code for the bone 11047, which covers 11047 is an add-on code which covers each additional 20 square centimeter or part thereof. Okay, since we have part thereof, that additional 5 square centimeter also we have to code using 11047. Okay, so now we have done with the 25 square centimeter of ulcer to the bone level. Okay, this is correct. Further, you can check up to subcutaneous, you have 25 square centimeter. So now you have to code for subcutaneous level. So this is for bone level, and this is for muscle. And for subcutaneous, we have 11042. Debridement of subcutaneous tissue, first 20 square centimeter. And additionally, you have 11045. It covers each additional 20 square centimeter are part thereof. So for additional 5 square centimeter for subcutaneous, you are supposed to utilize an add-on code as well. So in our question, you can see we have coded 11042 and 11045, which is add-on code. And here we have utilized 59 modifier to distinguish between two procedures which are under same header. Okay, same procedure, but we are just dealing with a different depth. Okay, so this is the correct answer for debridement. So if you are aware of the coding guideline of debridement, easily you can code for this. Okay, so this is one question they have asked. Next, there is one more question they have asked on incision and drainage of pilonidal cyst. Okay, in pilonidal cyst means that cyst which develops between the buttock. Okay, cyst which is developed between the buttocks. So in the pilonidal cyst, please make sure checking whether they're asking for incision procedure or excision procedure. So in our question, patient present with the pilonidal cyst requiring IND with extensive packing. With extensive packing. So if we have extensive packing, what does it mean? It like packing is not there means you will go ahead and code as a simple IND procedure. But here with extensive packing is there, so we have to consider it as complicated. Okay, so let's see the code for pilonidal cyst. I think, yeah. So pilonidal cyst are here. So incision and drainage 10080 is incision and drainage of pilonidal cyst. It's a simple method. 10081 is complicated incision and drainage of pilonidal cyst. So to consider complicated, if they have that kind of documentation like extensive packing is required, then you can consider it as complicated. 10081. Okay, 10081 is the correct answer. So you can choose this. If they directly give simple and there is no extensive packing is not involved, then you can select simple incision and drainage of pilonidal cyst. Okay, so for my knowledge, whatever the question I got, they were questioning about complicated IND of pilonidal cyst. So answer should be B. And if you get this question in exam, please make sure refer the complete question, and whatever they question, just analyze and then choose whether it's a simple procedure or complicated procedure. So next we have excision procedure. So in this excision procedure, they asked a the combination question, combination of malignant lesion excision and benign lesion excision. But for benign lesion, they did not the procedure is not about benign lesion excision. Instead, benign lesion destruction procedure. Okay, one is excision, one is destruction procedure. So excision means removal. Benign lesion destruction means in the same place they are destructing the lesion using cryosurgery or chemosurgery, electrosurgery, all those. So you can see 3.5 centimeter of malignant lesion, including margin. So you don't have to measure the margin here. They said including margin from the back. Okay, they have excised 3.5 centimeter of malignant lesion from the back, and also 2 centimeter of benign lesion from the cheek using cryosurgery. So using cryosurgery means it's a destruction procedure. Destruction of benign lesion, you need to take the code. So now first we will code for 3.5 centimeter of malignant lesion. So 3.5 malignant lesion code range starts from 116. Okay, excision of malignant. So in this 114 series we don't need this. Remaining option A 11606. Okay, so easy. So see here, these procedures are about excision of benign lesions. But if you check option D, 11604 is for excision of malignant lesion. 17110 is for destruction of benign lesion. Okay, I'll show the code description now. 11604, that is excision of malignant. So here is an excision procedure. So location is back. Okay, back means trunk location. 11600 says excision of malignant lesion including margin, trunk, arm or leg location. Excise diameter is 0.5 centimeter or less. Okay, so next codes will vary on the centimeter of the lesion. So in our question, they have excised 3.5 centimeter of lesion from the back. Back is nothing but trunk. So 3.5 centimeter means 11604, excise diameter 3.1 to 4 centimeter. This is the correct code for excision of malignant lesion. So option D has 11604. Okay, this is correct. And let's see what is 17110 also. So 17110, which comes under destruction of benign lesion. Okay, so see, you can see cryosurgery. Destruction of cryosurgery up to 14 lesions. Up to 14 lesions. Okay, so in our question, they have taken 2.2 centimeter of benign lesion, single lesion destructed using cryosurgery. So up to 14 covers in 17110. Both codes are correct. And coming to ICD C44509, this is a malignant lesion code, and D2339, this is for benign lesion code. Okay, so answer D is correct. So please, this is just question I have got from the student end, and through mock paper I have collected the questions. So please take time and go back and use these keywords and navigate in your book. Refer the complete concept. Okay, in single video I cannot explain all the things. Okay, so I am trying my best to give you few insights on the current year exam. Okay, it is already took so much time to prepare the document and to do all those. So next, fourth, the question is about burn treatment. Okay, so here physician performed debridement of second degree of burn on right forearm, covering 8% of total body surface area. So this is a local treatment. Okay, local treatment, and right forearm covering 8%. So let's see the codes for this. So here is the burn procedure. Okay, local treatment burn procedure. 8% they treated. So if you check answer 16025, which covers medium or 5% to 10% of total body surface area. Okay, so 5% to 10%. In our question, we have 8%. So that means our code should be 16025. Okay, 1 minute. The question what we have. Okay, so answer should be option B. Okay, so here 8% is there. Please check the ICD. Okay, ICD, I don't know what ICD have. ICD I did not open. So please just check the question. CPT should be 16025, because covering 8% of total body surface means 5 to 10%. Here is the code 16025. 16030 is large. It is greater than 10% of total body surface area. You just have to check the code. So partial thickness bar. So please check the ICD codes. Okay. Whatever is matching for the second degree right forearm, that you need to check. I think just a minute, I'll check that also. Hmm. 16025 T22. Yes, option B is correct. 16025. This option B is correct for fourth question. And also in this burn, okay, check the hysterotomy procedure also. So in this hysterotomy, we have two code. One is primary and one is add-on code. So hysterotomy initial incision. First day incision, you code 16035. If they do additional incision, say for example, together, maybe 3 incision provider has made to perform hysterotomy, means you have to code 16035 and 16036 with units 2. Okay, like this, you will code the hysterotomy procedure. Hysterotomy means after body being burnt, that burnt skin will not allow for the proper blood circulation. So they, to promote the skin growth or to make that breathing space, they'll remove the dead skin using hysterotomy procedure, otomy procedure. So that is called hysterotomy. So next question. Mohs micrographic surgery. Okay, so the question is about the surgeon performs Mohs surgery on lesion on right foot, requiring stage 1 6 tissue block, stage 2 3 tissue block being removed. So stage 1 6 tissue block, that means here one block is extra. Stage 2 3 tissue block, there is no tissue blocks are extra here. So I'll show the codes also. So location is right foot. And please don't send me messages asking send material. We will pay material. Please, I don't send only material to anyone. So I cannot make that, because there are so many regulations are there. If we can choose to teach, okay, we cannot just send some material and just make the coder to get passed without making them, or understanding the concept is very important. You can just mug up the material which I share and you can get passed. Later you will suffer. That's why even if you're paying money, I am not going to give any material which I am prepared. My thing is, I will teach, I'll make you understand, I'll make you learn that concept. Later you can get the question in the exam and you can get pass. Okay, then I'll be happy. So yes, Mohs micrographic surgery. So here, Mohs micrographic surgery is a technique of removal of complex hill-defined skin cancer. So you all know about this procedure. So here we have only 5 codes. The first 2 codes, this is the stage codes. This is an additional stage code. This is again stage code for the other locations. So first, what is the location? Right foot. Okay, right foot means 17311. Location is head, neck, hand, feet, genitalia. So 17311 is the stage code. You need to go. 17313 is for trunk and arm and leg. Okay, so not this anatomical grouping. We have right foot, so you have to deal with the CPT code. 17311, you will code for primary stage code. Okay, total 2 stages they have performed. 17311 is a one, it covers initial stage, covers single stage. To code one more additional stage, you are going to utilize 17312. Each additional stage after the first stage. Okay, and in each stage, we are allowed to take up to 5 tissue block. Okay, up to 5 tissue block. So if if the surgeon is taking more than 5 block, that means 6 tissue block or 7 tissue blocks, that extra block should be coded utilizing add-on code 17315. Okay, so this is for after first tissue block in any stage. So in the question, location is right foot, total stages they have performed is 2. Okay, first stage, 1 tissue block is extra. Second stage, there are no extra tissue block. So what you will code? You will code option C. 17311, it is for first stage. 17312, it is for second stage. And 17315, you are coding because in the first stage you got 1 tissue block extra. Okay, so 17315 you will code. The correct answer for fifth question is C. And next biopsy question is there. So they have did punch biopsy on the lesion from the trunk and tangential biopsy on one lesion on the forehead and one on the cheek. So total how much biopsy they did? Total 3. Okay, 3 lesions, and they have used on one lesion they have used punch biopsy, and remaining 2 lesions they have did tangential biopsy technique. So how to code? We'll see now. So just come to this table, okay, easy. So we got tangential biopsy and punch biopsy. Okay, one lesion utilizing punch biopsy and 2 more lesion they have utilized tangential biopsy technique. So when we are coding for multiple techniques in a single operating session, you need to go with the severity. Okay, so we have to code only one primary code, and the primary code should be the severe one. So when you compare between tangential biopsy and punch biopsy is severe one. Okay, so for the punch biopsy techniques, you will utilize 11044 as your primary code, and to report the tangential biopsy, okay, you cannot utilize your primary code of tangential biopsy. Instead, you have to code the corresponding add-on code 11103 each separate additional lesion. So here you have to give units. As 2 lesions they have performed, you can code 11103 with units 2. Okay, this is the coding guideline we have. So you can check here, when you have multiple techniques and multiple lesions performed on the same day, you are supposed to utilize only one primary code. Remaining should be coded using their corresponding add-on code. Using the particular technique, corresponding add-on code you have to take. Okay, so I think in old video I have explained this biopsy concept completely. Please go back and check. And the answer should be 11104 for initial initial lesion biopsy, that is punch biopsy, and 11103 is an add-on code of tangential biopsy with the units 2 we have given because 2 lesions performed utilizing tangential biopsy. Okay, answer is D. Next, nail procedure, ingrown nail biopsy, debridement, and ectomy procedure they have performed. Patient with an ingrown toenail undergoes partial or complete nail removal with matrixectomy. So ectomy of that nail matrix they have removed. So when we are discussing about nail procedure, you should also be aware of the modifiers. So check in nail procedures, we have the procedures vary like this. So 11750, excision of nail and nail matrix, partial or complete ingrown or deformed nail for permanent removal. So in our question, they have removed partial or complete nail removal with matrixectomy. So they have removed matrix. Okay, so 11750 is correct. So 11750 is the correct answer for 7th question. So as I said, modifier for nail for nail procedures or toe procedures, you have to code from the series F modifier and T modifier. Okay, check the location on which nail or on which toe they are removing performing the procedure. Accordingly, you need to select the modifier also. So in this question, I think they asked the modifier also. So say for example, they have performed toenail. Okay, toenail. Which toenail? Assume left great toe. Okay, on left great toe, they have performed the matrixectomy procedure. So for left great toe, what modifier we have to give? We have to give for left great toe, these are the toe modifiers. So you have to assign TA modifier along with the procedure, left foot, great toe. Okay, same way if they remove fingernail or fingernail matrixectomy procedure, you have to check the F series and on which finger they are performing procedure. Accordingly, you need to select the F modifier along with the procedure. Okay, so for this current question, option B is correct. So next, ATT procedure they have performed. So ATT coding guideline, you should be aware. They will be performing excision, and after that they will be doing ATT. So you have to code only ATT procedure. Okay, so here they were just asking on the range of ATT. So you can select option C. Next, skin graft. So here it is an HCPCS question. For aloe skin, what is the HCPCS code? Please check. So I think it is Q4115. Okay, just you can navigate both ICD code and aloe skin code. You can get the answer. Next, skin tag removal. So skin tag removal, as I said, physician removes 15 skin tags using electrosurgery. 15 skin tags removed. So what is the skin tag? Removal of skin tags. 11200, removal of skin tag, multiple fibrocutaneous tags in any area up to and including 15 lesion. So up to 15, you can utilize 11200 primary code enough. If you get additional, you can use additional code. Okay. So in this question, correct answer is 11200. Next question. Patient with the 3 thyroid nodules, FNA biopsy. Okay, 5 needle aspiration biopsy using ultrasonic guidance. The provider insert 25 gauge needle into each nodular tissue is aspirated and sent to pathology. So all of these 3 nodules, they did FNA using ultrasonic guidance. Okay, so all 3 lesions, same guidance they have used. So under FNA, you can see this is the first set of code. Here they don't use any image guidance, without image guidance. Next set of codes we have, that is based on the guidance type. So in our question, they're questioning about 5 needle aspiration, including, that means using ultrasound guidance. First lesion and each additional lesion. So for first lesion, you will code 10005, and for each additional lesion is extra 2 lesions you have. So you will use the corresponding add-on code 10006 with unit 2. Okay, this is the answer for the question. And if they use one lesion using ultrasound guidance and one lesion using fluoroscopic guidance, then you are supposed to use both primary codes using 59 modifier. Okay, but if they use same kind of image guidance and if they perform multiple lesions, you have to take the corresponding add-on code and you can assign the units. So for this question, answer should be C. 10005 and 10006 with unit 2. Okay, option C is correct. And here option A include 76942, which is ultrasound radiology code. Okay, here we cannot use this code along with these procedure because our primary code itself having the information about ultrasound guidance. Okay, so you cannot use, see, do not report 10005 and 10006 in conjunction with 76942. So yes, these are some questions. Okay, I have discussed. And on this same concept, we do have multiple other questions. Okay, from other CPC sites. So I think this video will help you to gain the actual exam insights, and definitely it will help you to get good marks. So please make sure watching all the complete video, and please ignore if I make any kind of small verbal mistakes, because I'm recording the session, just having all the work schedule and all, I couldn't make a PPT presentation. That's why from the ward itself, I have joined the meeting, and through meeting, I am recording the session. Okay, so in this meeting only I am there. Okay, so it's a solo meeting, you can say. So I have recorded the session now. So I think definitely it will help you to gain all the insights regarding integumentary system. So please do share with your friends, and please do subscribe. And I will see if the response is good from the other end. I will keep all this effort and somehow I'll create the videos. If not, I'll not bother. Okay. So it's very crucial because you people don't know, with all of this need to create so much time we need to spend on this. Okay, and I appreciate all those people who are creating informative videos. Same way, yeah, I think everything have covered now. Okay guys, that's all for today, and tomorrow if possible I'll try to do musculars, the 20K series also. Same way I will try to cover all the 6, 20, 30, 40, and 50, 60. All series I'll try to cover in the same way. So yes, please do subscribe, and thank you for watching this session. Bye bye.